Hi, I'm Brenda. I'm an LPN2 here at the Right Center. My favorite part of being a nurse is building the relationship, the respect, and the confidence of the patients and building that bond to help better serve them.
Oh, I love taking care of the patients, being with the patients, and I know that the patients rely on me, so I try to go above and beyond and help them with whatever needs they have.
Always enjoyed working with the elderly population. I spent a lot of time when I was younger with my grandmother and her sisters, so I always enjoyed working with geriatrics.
My biggest reward would be following patients from the beginning of a diagnosis to the end, seeing positive outcomes. Also hearing patient stories from the beginning of how they became patients, and you learn about their life.
I like being a nurse because I enjoy helping people. Somebody is sick and they come to you and they look for someone to help them get better. It's very rewarding. It's a very respectful job. I mean, there's a lot that you can do with nursing.
I like to teach the nurses and the MAs, respect and compassion. That's the biggest thing I feel a nurse has, is having compassion. You have to be an advocate, especially for your patients, because sometimes your patients don't know how to be an advocate. So when you see them either in the hospital or in nursing homes, you have to be the voice for them, because some of them don't know how to voice their concerns. So that's the biggest thing. We're here to be a voice for our patients, an advocate for them, and make sure they're getting the best care possible, and following up with them during their stay, after their stay, doing home visits. But you really have to be an advocate for your patient, because that's the way they will get the best care. Some do not have family members or a support system, so we become that support system for them.
A lot of patients, they have problems with their caregivers at home, they have behaviors, but when they call and say, this really worked, and that approach really worked with a patient with dementia, it really makes me feel good that I've helped them in some way.
The best thing about being a nurse at the Right Center is the access to all the resources that we have to help the patients, specifically in the community. We help patients get insurance, access to food, access to patient assistance programs. The access to the resources definitely make it easier to be a better nurse. As a nurse previously in other positions, it was difficult to really do everything I wanted to do for the patients. But here I feel like I have a lot more resources at my fingertips to use to better help the patient.
We have the resources, so you have to use them. So you come up with a team. So having a team together for complex patients makes a big difference.
So seeing the patients of where they started from and then where they end up, where it's a lot of teaching over the phone and letting them know what warning signs to look out for, whether it's COPD, heart failure, and doing a lot of teaching, because their main goal is to keep them out of the hospital and out of the emergency room. So we want them to have a healthier lifestyle, and give them any information that they can to keep themselves healthy and alive for a long time.